Hi, Andrey. Great to see you. Great to see you again. Welcome to the Cream Chubin podcast, the Million Minds mission. As many of you might know, my mission is to educate in a fun and dynamic way 1 million people across the globe, between East and West, on different longevity secrets, but through a novel approach through the prism of mitochondria. Today's guest is Dr. Andrey Iskornev. Andrey, a very dear friend of mine, an inspiration for me, a gentleman I met in Russia about 8 years ago. And Andrey has been a true friend, and time has shown that he's been incredibly loyal to me and an inspiration to me in many different ways. So Andrey is a plastic surgeon, a medical doctor who currently lives in Los Angeles, but who continues running and supervising a beautiful clinic in the epicenter in the old historical Moscow, where a team of practitioners, medical doctors, work and help people thrive and look younger daily. Andre, welcome.
Thank you, Karim, for having me. It's a pleasure. Long time not seen, and I also really appreciate what you do in your industry, and how collaborative we are when it comes to anti-aging, youthful, not only look but inner feeling, if I may say so.
Thank you, Andre. Thank you very much. So, Andre, you have a very unusual story. I mean, you were born and grew up in Russia, and you became very at a very early age a practicing clinician as a plastic surgeon. You, if I'm not mistaken, you earned a green card based on merit. You got a green card for the U.S., and you became incredibly
Marriage? Hold on.
not marriage, merit
Married. Okay.
on merit, as far as I know. And you have your own approach to beauty, to plastic surgery, your own philosophy that you've developed and refined over now more than almost 2 decades, I believe. And your age has always been a mystery to most of us. I mean, and your biological age as well. But I'd like you to share a little bit about your story and how you became incredibly westernized in your way of thinking whilst growing up in Russia, which was one of the first things that struck me and that I find incredibly intriguing for someone having grown up in Russia.
As I'm always kidding, I supposed to be born American, but a wicked witch made me Russian. But honestly, no. I appreciate my background, my international background, because the world is your oyster. It's much broader when the geography of your family. Yeah, so I graduated at Russian State Medical University in like I forgot how many years back, like more than 20 something. Then I I got involved into the residency in microsurgery because back then in Russia, we didn't have department of plastic surgery. So all potential plastic surgeons supposed to be trained either in cranial facial surgery or in microsurgery. So in my case, it was microsurgery. So it's easy to me right now to do those, tedious, monotonous job related with super tiny vessels teaching and so on and so on. So yeah, and our department worked with transsexualism. It was mostly female to male transformations, and there are so many difficult steps in those transformations. So it made me extremely skillful in aesthetic surgery as well. Then I spent almost a year in Atlanta in the Department of Plastic Surgery with Fod Nahai. This is a very well-known figure in international plastic surgery. He generously allowed me to witness what he does in his clinic in Atlanta. It's called PACES.
Sorry, so you're doing your residency in Russia. You're working with transgenderism and operations mainly from female to male, from a biological standpoint. Then you go off to Atlanta and you find a mentor there. How different was it coming from Russia to the US then? Was the approach, was the training of young doctors different? How did you integrate that in your knowledge and your practice?
It was a groundbreaking. It was a groundbreaking because back then, in Russia, we didn't have a lot of private practices related to plastic surgery or aesthetic medicine. The industry just started to thrive, and it was great experience to really see how internationally well-known professionals run the business all together in one clinic. Because besides Fortnheim, there were five other surgeons helping him in um, lipofilling, in body contouring, in laser skincare procedures, and so on and so on. So it allowed me to actually see how practices like that must be operated. Yeah, it was like a foundation in my career, I should admit, because Fodna High is a well-known specialist in face rejuvenation, and basically what I do right now, all of this. Is based on his scope of practice in facial reconstruction. So yeah, I saw my first facelifts. Yeah, I saw my first facelift with Fodna High in Atlanta back then. Yeah.
You went to Atlanta, you witnessed that, and that shaped did that actually motivate you and inspire you then to bring this knowledge and to focus on that aspect?
Yeah, yeah. I brought back all the experience. I opened my first clinic. It was called Naomi. Uh, yeah, because I was young and ambitious, and I thought Naomi is a brilliant name associated with aesthetic. Um, yeah, so we opened a clinic with my partner. It was actually one of the first aesthetic clinic in Moscow. So we're like dinosaurs in this industry.
And when you came in with your partners at Dinosaur, were you doing only plastic surgery, or were you also offering, fillers and aesthetic?
We did everything: lasers, injectables, minimally invasive plastic surgery, difficult types of reconstruction. Yeah, but that allowed us to hire the best professionals to this practice. Of course, I was super young and I could only assist back then. But again, since we hired so many brilliant specialists. They gladly invited me to participate. That's why I started operating super early, and it was possible only in Russia back then, historically. Because nowadays, of course, with all this incredibly long training, it sounds like a fantasy. When someone tells you that he started working even as a surgical assistant at the age of 20 something. Yeah, so we did. Personally, I emphasized on aesthetic facial surgery. My colleague did breast reconstruction and tummy tucks. What do you call, yeah, abdominoplasty. Another colleague specialized in rhinoplasty, yeah, nose jobs. Now, I had maybe four dermatologists who did lasers, injectables, yeah, all these kind of non-surgical procedures. Yeah, so it was pretty wide, multidiscipline aesthetic practice.
So the two partners were both MDs, and you were both complementary to one another. And then you surrounded yourself with, with a team of leading specialists. And how did you manage to combine being a caring physician and someone always at the forefront of what you do with being an entrepreneur? I mean, some people have the two brains, and you managed to do something quite exceptional.
That was the most challenging part because you need to focus on both, which is, as you said, it's rarely possible. Because when you go to the surgery, it's 4 to 6 hours, and you step out from the op room totally exhausted, worn out, not capable to manage things, but you're supposed to. So yeah, I believe it's somehow related with my artistic part of the brain and the logic part of the brain, because normally my colleagues, as you said, they do either or.
Interesting. So you started doing that, and then when we were introduced through a common friend about 8 years ago, I saw your initial clinic, which was already beautiful, but now the one that you've created in Moscow is really, really outstanding. And how did that evolve? So you went from Naomi to the clinic that I visited in.
After Naomi, well, we overleaped another economical crisis back then, and we supposed to sell the our landlord is supposed to sell the space we accommodated. So we was forced to close the clinic and start from scratch with my minor partner. So we decided to launch a new project, also related with aesthetic medicine, and I call the project the Platinental. Uh, it's a totally made up word. I mixed intercontinental plus platinum because I always wanted to keep the platinum standards in the industry, but at the same time I also wanted to implement only internationally well-known procedures, involve all the best existing in this world, helping both male and female to stay younger as long as possible. Yeah, so I opened this project called Platinental, and we organically grow grew. Yeah, we started implementing more and more complicated plastic surgery operations. Of course, mostly related to aesthetic medicine, but it was a huge reconstructive component involved. We started doing bone reconstruction, mandible and maxillary reconstruction, all this cranial facial parts of aesthetic medicine world. Yeah,
And how did you, over the years, perfect your skills? Did you travel back to the US to the same mentor? Did you find other mentors? Did you go to France? I mean, were you inspired by Brazil? I mean, I hear the Brazil, and again, I'm a novice to the field.
constantly. Yeah, that's why it's called continuous medical education. You keep on traveling, you keep on watching what other surgeons do. You keep on attending congresses and conferences because basically before you start operating yourself you need to accumulate all this knowledge coming from other professionals. Only by viewing lots and lots of other surgeons you can understand what would be your own approach in aesthetic medicine. So it's always a synthesis of other people experience with cutting edge technologies.
Are you still in touch with that initial mentor from Atlanta? Does he see the work you do?
I saw him maybe 3 years ago in, I believe, in Texas on conference. Yeah, he's still in the industry. He's um, he doesn't operate anymore, as far as I know, but he attends all those congresses, and he's an honor professor in so many institutions. So.
So that sounds like a bit of a silly question, which I hope it isn't. But the question is, how in a market such as Russia, where beauty is at the epicenter, there's such a competition. Well, not only among women, but I think also among men. But I mean, there's the way we understand it in Europe is that in some ways Russia is very close to California, no, in some ways, or maybe even more cutthroat. In other words, they've gone faster than Europe at catching up on technologies, incorporating them. How did you manage to stand out and remain at the top of your industry in a market which, so you were a pioneer, but in a market which became, ever so more competitive?
First of all, you should really love what you do. You should really love what you do. It's not a business. It's your
Passion. It's a calling. It's a call.
passion, legacy, yeah, everything. It's 80% of your life because you're basically married to plastic surgery. So you should really love what you do. And plus, when you see how life changing those operations might be to lots of our clients, it's like being on stage. You can't live without it anymore. And you're right. This is plastic surgery and aesthetic cosmetology. It's extremely fast-moving industry. Every year we have new devices, new technologies, new protocols, and you should be able to be on top of it. Share your experience. This is also very important. I participated so many conferences and congresses, master classes. Yeah, you can say I own my exclusive method and stick with it. No, you you're supposed to share what you do and receive objective critique from other specialists. So to be
How do you welcome criticism when colleagues or patients, if someone's unhappy, because of course you have mostly happy patients, but if some people say, "Oh, I'm not really happy with this result," do you accept criticism, if I may ask, or how do you incorporate it, and then how do you turn that around?
I accept, yeah, I accept criticism when it's not just the opinion based on nothing, but constructive criticism. Of course, it's this is something helping us to finesse what you do.
And also, when patients come to you, I mean, Russian, especially women, as far as I know, are notorious for coming to Western physicians and saying, "I want these lab tests done," because in Russia you know, you can choose, and you can't in the West. It's all things are structured a bit differently. When patients come to you and they say, "Oh, I want a nose like this or a mouth like that," but you have a different vision, being an aesthete and being a professional, do you give in to their wishes, or do you actually explain to them why you would approach that operation differently and what outcome they might expect, and then try to convince them to rethink that design?
I believe that plastic surgeons have this educational part in our jobs. We have to stick with our aesthetic philosophy because especially nowadays with the development of social media, there are so many trends changing every day. And if you'll be changing your opinion every month according to the Instagram trends, you are not the best specialist, I would say. There are certain criterias existing much longer than Instagram itself. There are so many artistic proportional rules existing in a facial portrait, and you're supposed to tell people about it, because I remember, well, maybe 10 years ago, everyone became so crazy about Bisha fat pad removal. This little fat pads under the cheekbone. Lots of patients were crazy about having this heron chic look. Yeah, prominent mid face and a little bit hollow lower face. Then this trend changed to baby faces. Yeah, everyone wanted to have this Asian form of the face. Then became the era of thread lifting, which I don't like and don't support. But a lot of dermatologists promoted thread lifting as the new way of facelift. So the a plastic surgeon should be like a firewall. You should protect science and technologies against those newcomers. Yeah, and that's important because plastic surgery is still surgery. It's very conservative industry, and time should pass before we implement this or that technology into the everyday practice.
Interesting. And do you do you create roundtables with colleagues in the West and in Russia and different Asia, different parts of the world? I mean, one thing is reading and following all that's coming out and analyzing it, digesting it, synthesizing, but another thing is also exchanging notes with colleagues. How do you keep that? Do you have room for that or enough bandwidth for that as well? Because I know you work very long.
Not personally myself, but there are constantly upcoming congresses and conferences when we invite specialists, as you said, around the table from different parts of the world, and we talk, we discuss, we scrutinize. Because for instance, in Brazil, where the beach culture is so popular, the mommy makeovers, breast augmentation is extremely popular. So we keep on asking our Brazilian colleagues what you do with bodies, so your clients look like that, almost like a perfect statues. We ask American surgeons, what do you do with faces so our clients look so natural? Now it's sort of background. Now we're being asked by colleagues internationally what we do with faces, because I should admit that Russia is extremely successful in the plastic surgery industry right now because of the demand, because of maybe the average psychological portrait of our patients. Because Russian ladies are so concerned about their look, and the standards are so high that yeah, we
Much more than men, Andre? Much more than men, or is the trend changing now, and more men or the younger generation?
it's changing. I should admit that we have more and more male clients nowadays, but most of these men were brought by their wives, lovers, yeah, female.
Also thought it very interesting is that I remember an epoch when I was, getting interested in naturopathy, so 20 years ago, 23, 4 years ago. And I remember that many Russians would come, ladies, to Western surgeons, to French surgeons, etc. So you managed to establish yourself with your colleagues and now even prior to 2022, many doctors, many patients now actually seeking and were seeking prior to 2022 physicians such as yourself in Russia. There's also a trust factor and there's also how you accompany patients, because in the West, we have a much generally colder approach, more transactional approach to health. In Russia, there's a warmer approach, like in the Middle East, where you're closer to your patient. You often befriend them.
There is such a thing as a preventive medicine in Russia. It's extremely popular because, well, for instance, in the United States, you can go to doctor for preventive MRI scan of your head because you feel like you need it, or run your blood work because you want to check your vitamin D load, for example. It's a symptom based here. So your primary care physician would show you the way. In Russia, there is such a thing, as I said, as a preventive medicine. A lot of people do things before they actually before the problem appear with their body. And yeah, so plastic surgery is not just surgery itself. It's also very interrelated with um, um, hormone replacement therapy, with cosmetology, with other physicians involved in the team to maintain a certain way of feeling and looking.
And there is a plasticity in the Russian mind and soul which allows you to absorb and to take on innovation. There's an openness. I remember when I was entering the Russian market a bit more than 10 years ago, the words hormone were very scary for most Russians. And now Russians are much interested in how they can increase their health span and lifespan by using different methods. And as many of us know, Russia pioneers, the former Soviet Union were pioneers in stem cell therapy, in peptide therapy, and now with
And now peptides are everywhere. Injectables, skincare brands, everything's based on peptides nowadays. We try not to use hyaluronic acid anymore. as low as only possible.
Only a question: when you are such an aesthete such as yourself and you see perfection, or let's say imperfection everywhere, but you strive towards perfection, when you have a patient come in, do you is there any room for a slight touch of imperfection, which maybe gives us all something a little bit natural and human, or or does nature have to imitate art? To paraphrase Oscar Wilde, or not? Or when you speak to your patients, you say, "Look, this will be the ideal, but I believe, I Andre, that if we have a little bit of that, it'll make you."
That's the point. I never start conversation myself first. I always ask what brought you to the facility. What don't you like about yourself? Because again, I don't want to involve my personal tastes on the table. Yeah, because maybe the client came to remove a little mole on the face, and I would suggest a person to do a facelift, for instance. Because plastic surgery, it's primarily psychological help to our clients. Yeah, we give additional self-esteem with what you do, with what we do. And yeah, it's better to do less always. If a little tiny injection will bring you joy, feeling of that you are sexy and powerful again, and you can do whatever brilliant.
It must be incredibly rewarding to feel that you can change someone's not only outer capsule, but by doing that, you affect their psychology, their self esteem, their self love. I mean, you must have, I mean, many people who come to you afterwards and who, um, are deeply grateful because their lives have been transformed in a.
It's true. It's true. It's true. And some people, some clients, they change the lives dramatically. I saw so many clients after divorce, for instance, when ladies at the age of, I don't know, 45, 50-year old, see no reason to live any longer. I mean, not just it's not like a suicidal thing, but it's about the desire to do a makeup, for instance. Yeah, to do something to be the better version of yourself. And when ladies, unfortunately, by this or that reason, lose this feeling, yeah, they tarnish. So we're trying to upload this youth content again, if I may say so.
A new start. Audrey, I remember in one of our beautiful evenings and dinners in Moscow, you spoke to me about a wonderful trip that you did to the US where you went to Yale for another one of your trainings. And you refined, if I correct me if I'm wrong, the name harmonization, and you started speaking to me about it. Could you just give us a little teaser about it today, and then we'll continue in our next podcast. We'll find out if you're ready to share more about these secrets and educate a Western ear.
Yeah, I was in Yale Art School. It was the program related with digital art, anthropomorphy of human body, basic drawing, etc., etc. So it was all about facial proportions in art and in life, because there are so many different approaches to perfect face during Renaissance and centuries after. Durer, who else? Lots of other artists implemented their own way to the question of perfect face, the golden ratio, and my task was actually to plunge into the world of facial proportions related to gender, age, nationality, and something that I came up doing afterwards. I call it harmonization, harmonization of facial surgery. It's basically about enhancing, improving your own beauty, if I may say so, because we all attractive, but sometimes we need a certain aspects to be triggered in order to emphasize it. So yeah, I did this project called harmonization surgery. It based on facial symmetry, something called averageness. It's another topic, but I will elaborate later with you. Uh, yeah, and sexual dimorphism, because dimorphism. It's about, maybe I will sound super old school, old fashioned, but a man, it's not like, well, mm, it's about the man looking like a man and woman looking like a woman. Nowadays we have all this vinaigrette of genders, sexuality. Just don't mix it up. It's about different things, because in male surgery there are certain criterias, there are certain anatomical features helping us to understand that this is a man. There is a certain macho man look, with prominent cheek, prominent jaw angles, mandible angle, etc., etc. There are certain female features for the face, because it's related, it's interrelated with hormones, with estrogens. You know that even better than I am, because everything is so smooth with estrogen. And we should take it into consideration when we plan plastic surgery, because when we add a male features to a female face, we would have very unpredictable result. And since plastic surgery is very much interlinked with psychology of face perception, or sometimes with the slightest wrong move, we can completely destroy the private life of our client, the professional life of our client, etc., etc. So it's all combined together.
This is fascinating, and this is actually there's a beautiful crossover with how I studied why I studied anthropology, and then got into naturopathy, because, as you said, this sort of classical understanding of male versus female can be and is very much modulated through hormonal expression. So, in other words, when you see a man or woman walk in, you actually, through their morphotype or constitution, can actually understand a lot about their psychological blueprint and their emotional blueprint. So this this opens up a new question, which will be, I guess, a topic for another conversation, which is that when you prepare a patient for a surgery through nutritional balancing or hormonal balancing through different mechanisms, you can help them accept the person they might become, and then how they transform when you actually operate on them, or vice versa. You operate and then you support them hormonally from within, and then you have a complete approach to their self perception. No?
Mm-hmm. It's true. It's true. It's true. Because as I said, if you want to look younger and healthier, it's not about plastic surgery or cosmetology only. It's about your hormones. It's about your diet. It's about sport. It's about lots of things. Before any plastic surgery, we implement something called, well, in LA, in Los Angeles, it's called Bel Air diet. Basically, it's just a wise combination of fish and fibers. So I'm trying to reduce consumption of red meat before the plastic surgery. Not completely. I'm not turning you into vegan or something, but we just balance the amount of red meat if you love it. Now there is a certain way to maintain your hormones after the surgery. This is your department. It's supplements plus certain food we recommend, plus certain procedures we recommend after the.
Only thank you very much for this beautiful, for sharing. I mean, your story, and little clinical pearls. And with your permission, I'd be delighted and honored to pursue this conversation with you very soon.
Yeah, let's talk about harmonization a little bit more because I'm sure it will be interesting to our subscribers, our viewers. Yeah, because we all want to be liked, we all want to be accepted. Important, it's important how to make it smart, not to overdo plastic surgery or cosmetology injections.
That's very true. So less is more, and to talk about the importance of how it all links together, because people now are looking for integrated solutions. And wonderful. So just to conclude on this, your clinic is still very much operational in Moscow with a team of physicians, and you'll talk to us more about it next time. So for those out there looking for a plastic surgeon and for a gentle, personalized, and sustainable approach to beauty, I warmly recommend that you.
So someone I supposed to start my online consultations already. That's why someone's keep on disturbing us. Yeah, well, as you said, the clinic is based in Moscow, but we're opening a branch in Los Angeles right now. It would be a different, little bit different focus in Moscow and Kazakhstan. It's more about plastic surgery itself. In Los Angeles, it's more about injections and lasers and nutrition and holistic approach, as you said.
Like, I can't wait to come and visit you. I'll be in Miami next week for a congress. I'll talk to you about that separately. I'm presenting at a conference. Look forward to coming. And when is it due to open in LA?
I'll keep you posted. I'll keep you posted.
You'll keep everyone out there posted. Okay, great. Andre, thank you so much. I know it's early in LA.
Thank you. Thank you so much.
Thank you. Speak to you very soon.
Thank you so much. Yeah. Bye bye.